Happy Monday, friends. I'm here with Derek Bayne, one of the counselors at Mayfield Counseling Centers, and today we're going to talk about existential therapy.
And it's time for your Monday Minutes.
So Derek, as we talk about this idea of existential therapy, where do we even start? Like, what is that? What does it mean?
Existential therapy is essentially trying to discover purpose and meaning out of yourself and out of life. I think in a lot of ways, people struggle with defining what they're supposed to do with their lives.
So is this like career counseling, or is it?
It can be a collaboration of things. Some of it's career counseling, some of it is self-awareness, some of it is self-image and self-esteem, and some of it is interpersonal relationships.
Okay, so then existential therapy, it's like different modalities of counseling where we might have dialectic behavioral therapy, cognitive behavioral therapy, emotionally focused therapy, these different approaches to counseling. Existential therapy is essentially the same thing.
Correct. As a matter of fact, existential therapy doesn't even have its own techniques. It uses techniques from other therapies, and it actually improves those therapies along with existentialism.
Mm-hmm. Well, and I think most of the time therapists will agree we're adapting different systems, and it comes down to our question of how does change occur, or what causes problems.
Right. One thing that I've always tried to explain to my clients is that it's not so much that the human condition is a problem, it's the way we perceive the human condition. And I think in a lot of ways, it's having a displacement or an absence of values creates psychological distress. And so the more we understand our values and how that incorporates with our personality, the less distress we experience life.
So does that mean if I was to come in for counseling to an existential therapist with anxiety, we might not be focused so much on the anxious symptoms as much as maybe how I'm perceiving the stressors in my life, or?
Correct.
Okay.
Yeah, so with existential therapy, we try to focus on present day concerns, and we'll only do retrospective therapy when we feel that that's a useful tool for correcting the here and now, the present issues. Because what we want you to do as the client is develop responsibility with choices and engaging with future possibilities.
So I'm not going to come in and lay on the couch and talk about how my mom messed me up. I'm going to come in and I'm going to talk about what's happening currently in my life, and if there's present day meaning to me being able to reflect on some of the things that happened in childhood, then we would engage in it, but that's not our first step.
Correct.
Okay. And so, and one of the things that I like about existential therapy is that here and now kind of concept. Like, it has to be in this moment because that's all we can do things about.
Correct. Everything that happens is a series of consequences, and we often see choice as dealing with positive or negative consequences. In reality, all choices have both sets, positive and negative, and it becomes a deciding factor of what negative and what positive sets you want to deal with, because they're both going to come at you no matter what you do.
Sure.
In that you have the freedom to be yourself, knowing that there is no one correct way.
Okay. Yeah. So, Derek, help me understand what kind of client or person is existential therapy best for? Like, is there a specific kind of person that does better in existential therapy, or a certain kind of person that really does not function well in existential therapy?
I don't know if there's a limitation to that.
Okay.
I personally enjoy working with anxiety, PTSD, anger management, and I have seen existential therapy do wonders in those areas. But I've also used existential therapy with couples therapy, family therapy, and even depression and things along those lines. And the possibility of growth is always there because we as people have the ability to become authentic.
So it's almost like this journey of like, how do you become more true to yourself and the true self isn't struggling in the way you're struggling?
Yes, I think it does come back to understanding that struggle is trying to fit into a system that isn't really designed for us specifically. And so we have to learn how to incorporate who we are into the system in which we have to operate.
Okay. So if you were to give a takeaway thought for somebody as they're thinking about existential therapy, it's more of like it almost feels like a scholarly conversation, not something you would maybe bring up at the dinner table. But if somebody wants to explore this idea of here and now presence, existential, becoming self and authentic to self, what would be like a question or a thought or a prompt that might be helpful for them?
There is no such thing as right or wrong in a hard definition.
Okay.
We dabble with, is there such thing as a gray area? And in reality, because all choices have good and bad, everything's gray. And if everything's gray, we have the freedom to operate on both sides of the fence. We're going to be wrong at the same time as we're going to be right, so don't try to control what's right. Try to be true to what seems the best for your situation.
Interesting. Well, if you want to dive into a little bit more of even what that question is about or that prompt is about, Derek and I will be continuing this conversation on The Collective. You can find the link in the description below. I hope this has sparked some thoughts for you. We'd love to hear from you. Until then, get yourselves through Friday, enjoy your weekend, and we'll see you on Monday.